You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, misconceptions in dentistry. With us, we have a dentist that wants to lay up some of these misconceptions and controversies to rest. With us, we have Dr. Remington Townsend. Dr. Townsend, welcome to the program.
Thanks. Pleasure to be here.
Now, before we get into today's topic, and I have a lot of hot topics from metal fillings, mercury in the mouth, to Zoom whitening, to teeth in a day, and lasers, and all of these things. And you have strong opinions about all of those things. But let's start with your practice. I guess you have practices spread all over Montana.
In several locations, we have some practices in Hardin, Montana, Laurel, and in Billings.
Where do you work out of?
I work in Billings.
Billings? Okay, good.
Great location.
Your topic is very unique. I don't think we've ever talked about it on the show, but misconceptions or controversies in dentistry. And so let's kind of jump right in and talk a little bit about metal amalgam fillings or mercury fillings. You know, here in California, boy, there's some really bad press about these. And dentists, you know, have even been on my show, bad mouthing mercury fillings.
Yeah.
What are your feelings there?
You know, it's interesting that you asked that. It's kind of a roundabout answer to a very direct question. But I'm going to ask you a question. Have you ever heard of dihydrogen oxide?
I've heard of it. I don't know what it is.
It's DHO. It is the most dangerous chemical on the earth, causing more deaths in China. 500,000 people in the last century in China have died from it.
Okay.
That's more than anyone with heroin addiction or anything like that. In the United States, in the 21st century, last year, 4,000 people died from DHO.
Okay.
It's a dangerous chemical. It's used as a fire retardant. It's used in nuclear power plants. Unfortunately, sometimes it's added to the food that we eat.
Okay. So what does this have to do with mercury fillings?
Well, that's interesting. Dihydrogen oxide, when it's also in its solid state, can be dangerous to human limbs. People have lost limbs due to this product.
Okay.
Do you know what dihydrogen oxide is?
What is it?
H2O. It's another compound name for H2O, water, simple water. So in the world today, we can take a simple product that has many good applications, and I can twist it and I can turn it and make it sound as if it's the worst product.
So you think mercury is not something you have to worry about? It's
It's
leaking,
been proven.
So it's not leaking out into your body and causing neurological problems and all the detoxification problems?
Well, you know,
there are some.
I do.
Think it's overblown?
Well, the studies have shown that it's overblown.
Okay.
There are studies after studies. The FDA has said it's safe. The American Dental Association has said it's safe. And what actually leaches out, now they used to say it was inert, you know, completely inert. Nah, there's some vapors that come out, about 0.08 to 0.2 micrograms per filling.
So
That's
it's nothing to worry about, in your opinion?
No, I mean, dentists for years have been using their dental practices for 20 to 30 years, 8 hours a day of high concentration of mercury vapor. No side effects.
Okay. Well, let's move on to why we bring that up in the first place. Because you say that if you don't offer that, it may be a disservice to your patient because the other alternative, these white fillings, are more expensive.
They are.
Is that right?
They are. Well, what's the number one reason why people choose the white ones? The number one reason.
It looks good.
It looks good.
Is that the reason?
Yeah.
Okay.
Did you know what the fastest growing segment of the population in the United States is today?
What is it?
It's women 100 plus years old. The second fastest growing population
You're filled with these great statistics.
is women 90 and above. So when you look at them and you tell them, hey, aesthetics is really important here. Or do you look at them and say, let's give you something that's going to last, that I can put in there, that's inexpensive, and has been proven to work well for centuries.
So you like metal amalgam fillings simply because they last longer and they're strong.
It's not that I love them. I mean, they're ugly.
But for the back teeth, you like them?
Yeah. I mean, they're great. They're a great tool.
And they're less expensive.
Mm-hmm. And the minute we take them out of our tool belt, that's when we get in trouble. The minute that a doctor can look at someone and say, I don't use those because they're bad. Well, I can tell you 1,000 reasons why tooth-colored fillings are bad. They have byproducts in there. They're
the
plastic.
adhesives, I guess what the adhesives, you don't like those adhesives.
No, it's not the adhesive. It's the plastic itself. It's a carcinogen. And BPA, which is a byproduct, when it comes in contact, what happens is you place a filling. Saliva comes in contact with it. And this byproduct called BPA is released. It's known in children to cause mood changes, irritability. It's been advised by the FDA.
But once it's hardened in these plastic sealants or these sealants, isn't then that no longer a problem? Just like mercury, when it's hardened in the metal?
No, that's the problem. It's once
really
it's set up and it comes in contact with the saliva that this byproduct is released.
So you think those may be more dangerous than the mercury?
No, what I'm saying is there isn't a great product. Everything we have has a negative side. The problem is that people don't have all that information that's given to them.
On your own family members, would you recommend the metal amalgam for the back teeth that don't show?
It depends on the location.
If it's like on the back teeth that don't show, you think?
Actually, it depends on what they want. It's more important.
Good for you, good.
Yeah, it's more important that the patient gets what they want. So you have to lay out.
At least give them that option.
Right.
Let's move on to the next one for the sake of time. This like 1 hour fast whitening in the dental office. You're not a big fan of it.
You know,
and don't hold back here.
It's a great product. The problem is that the light has been shown not to.
This is where you get in the chair and they put a big light on you.
Yeah, the light doesn't do anything. The light doesn't do anything. No, it's been proven that it doesn't do anything. Time in and time again, and we're still waiting for it to actually do something.
Is it more expensive, this 1 hour fast whitening?
Yeah. And so, you know, it's funny. I actually had a colleague that was, dumb enough to admit, he's like, I know that it really doesn't help, but it's
This is what dentists talk about behind the scenes.
Yeah, this is what one of my colleagues actually had the gall to tell me, hey, listen, it's just easier to sell it because it's expensive when we put a light with it.
Okay, but for the sake of whitening and for the sake of time, you're saying that, and I don't want to put words in your mouth, that just whitening trays are just as effective, if not better?
Well, it really depends. That's, again, where we have to find out what our patient wants and needs. If they're going to a reunion and they need their teeth white today, you probably want to do the in-office bleaching.
Okay, there you go. Okay. So there is a good application.
There is a good application, but the downside is it rebounds a little bit quicker. So it gets whiter, and then it drifts back into the not as white stage again.
Interesting.
So you can spend a lot of money and get your teeth white really, really quick and then have it rebound, because then we have to send you home with home whitening gels. Or you can save yourself some money, do it a little bit slower, and have a better, longer result. And it's information like that patients just don't know.
I love your enthusiasm. We have to move on down here. This is good. Teeth in a day. Getting teeth, the same day teeth, like these machines that mill the teeth right there. Even that, you say, kind of bugs you or frustrates you, or you can describe it.
Yeah, in a fashion, it's great. I mean, dentistry has become an incredible engine for development and growth in the world today.
But teeth in a day, what's the problem?
Well, see,
because they're doing it in a day.
They are. The downside is they're ugly. You can't get a great product from it. Granted, the science is coming, and we have to have people that are buying it and using it so that greater growth and development can happen. But sometimes I think in our effort to make things fast and easy and to make more money quicker, we forget all about the patient, which is and should be our ultimate goal.
So you're saying that the crowns that you could, and by the way, people need to know this is a real interview. I'm not endorsing you. I'm just asking the questions. But you say that they don't look that good when they're done that quickly. Is that right?
I have seen 1,000 of them.
Okay. So you're saying if you just wait a week or 2 weeks or sending it out, you get a better looking tooth.
You can.
That's more natural.
Mm-hmm. And the problem is you can have some dentists that have done a gazillion of these. I mean, just so many of them. But the learning curve on it is huge. So in order to get something that is perfect and looks great, it takes so much time that you start to wonder, was it worth the sacrifice of all those patients before?
Okay. So there are dentists, though, that know how to utilize those machines to do it right.
Oh, absolutely. But it's a tough technique.
Okay.
And is it ever as good as a lab one?
Tell me, what do you think?
It's coming.
Well, so you think it's not there yet?
I don't think it's there yet.
Okay.
I wouldn't put it in my own mouth.
Is it less expensive? You wouldn't. Is it less expensive than what you do in your office?
It for the dentist.
I mean, are you less expensive?
It costs me more to do a lab version than it does the doctor that does it in office. It's actually quicker, easier.
But they can make more money if they own the machine.
Yes.
Okay.
Yeah.
But those machines are over $100,000, right?
They are, but but you can pay that's a year and a half of dental lab fees.
Okay. Well, good for you. Good. Okay. The other thing, lasers.
Yes.
Big push for lasers to get rid of gum disease. I've had this procedure done on myself. So I'm dying to hear what you have to say about this.
Lasers are great. They've been around for 35 plus years. It's phenomenal where we are with them today. The downside is that there's conflicting literature that says that lasers don't cause any problems and lasers do cause some problems. There are some irreversible consequences that they actually have on root structure. A change in temperature can destroy the cells, causing external and internal resorption of roots. They've been shown to not eradicate bacteria.
So you don't like lasers for the treatment of gum disease like bleeding gums, bad breath,
They're great for gingivectomies. That's removal of tissue right around the tooth.
but not for killing this bacterial infection? in your
No, it
opinion?
doesn't work. And studies have been shown it doesn't
All
work.
right, okay. Well, this is controversial, that's for sure.
Yeah.
And
But it'll get there.
but knowing you're going to come on my show to talk about controversies in dentistry, why talk about this topic? What's your goal here?
You know,
I mean, what do you want the public to know about your practice in your office?
see, and I think that's the biggest key, to be honest with you, is in my office and with the doctors that we associate with in our practices, it's all about educating the patient. Again, with the water thing, with H2O, I can tell you that there are 1,000 things that are wrong with it, but yet it's absolutely essential. So in the dental profession, it's important that we teach our patients what the pros and cons, the good, the bad, the ugly are, and then allow them to make the decision. I don't want to push one way or the other. Tooth-colored fillings, my mom, she wants them. That's just great. But there are other people that don't. So when you present them with the options, they get to pick, and they ultimately get what they want.
Do you think, now we're talking about in the green room, and I was getting the impression, correct me if I'm wrong, that you think there's a lot of overselling going on across the U.S., not just in Montana, but across the U.S., with dentistry with patients.
Yes, I think
You believe that?
I do. I think our profession has taken an absolute nosedive when it comes to the ethics. We are overselling, overdiagnosing, over-treatment planning, and for what? You know, it's different for each case, but most of the time it's for money.
Anything we haven't talked about? And final message that, well, obviously, look, you wanted to come on my show and say, hey, look, we're not a practice, and I'm paraphrasing slightly, but we don't oversell our patients. We give them what we think is best for them.
Yeah.
Like we would do to our own family member. You know, and you said, by not offering metal fillings, you're doing a disservice to patients.
Yeah.
Because if you're only offering the more expensive option, you may lose a few patients that are walking around when they need a filling and they're not getting one, right? So what do you say to the patients? A final message, somebody hasn't been in the dentist in a long time, and maybe that's one of their fears, being pressured into something they don't need, or they're worried about cost. What do you want them to know about your practice?
I want them to know about every doctor,
Okay.
or even about our practice, that find someone that cares, that wants to
Okay.
treat you the way that is best. And you know, that's difficult because everyone has their own little idea of what they think is best. But scientific-based literature and why we do things is a big reason why you should do things. My mom used to, she told me a story about this lady that used to, when she cooked her chicken, she'd take off the chicken legs. So the daughter always took her chicken legs off. And then her mom came by and said, why are you taking your chicken legs off? Well, and she's like, I don't know, you always did it. Well, I did it because our oven wasn't big enough. So, where was I going
So you
with that?
question, I guess, that in dentistry, that oftentimes that you're doing things a certain way because that's the way it's always done.
Yeah, or you do it because you think it's the best thing to do.
Okay.
When science, you're like, well, the people that own the lasers and the people that are selling them, they tell me it's good. You have to do a little bit of research. You have to know
Okay.
what you're getting. I used to have a dental professor that would walk around the denture lab, and he says, knowing your materials is key to success.
What if somebody says, this guy's just old school?
I probably am a little bit, but it's better to have scientific-based answers than this is what I think.
We're out of time. This is good. Great stuff. And so if somebody hasn't been to the dentist in 5, 10 years, 15 years, come in. Meet with you, face to face.
Yeah,
And you're going to give them all their options.
that's exactly what we'll do.
All right. I want to thank you for coming to the show.
Thank
Very
you.
interesting. Good for
Pleasure.
you. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview online, you can visit our website, put in Montana Dentist, or you can put in Dr. Townsend, and you'll find him there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez. the authority on health issues.